Here we're recording. You're good to go. Here we're recording. You're good to go.
Okay, great. Thanks. Hi, everybody. Welcome to Board of Health for the month of May. We'll go ahead and get started. We do have a couple of members that are joining late, so we'll start with the non-voting items first, and then move to the items that require voting as soon as they hop on. So the agenda will look a little mishmashed today, so I hope folks don't mind, but I'll try to get to everything that we can. So we don't have anybody for privilege of the floor today. So let's go ahead and jump right to the financial summary. Brenda, if you've got anything in addition to what's in the board report to add.
I included both another 13th period or the end of 2021. I think that will really be the final report for 2021.
Okay.
The county's going through their audit, so we'll see if there's any further changes made. 2022, I've included month 4, which is about a third of the year. We're still carrying some of the same kinds of things we saw for the last couple of years with sampling costs, showing an inflation in our budget. However, I just submitted a resolution to committee and the legislature to put $2.1 million of reimbursement on the books to start covering the ongoing expense. That was the estimate given to me from finance yesterday. So that will probably go through the ledge their second meeting in June. Other than that, I don't have anything. We continue to work through grant claims. First quarter state aid is nearing completion. And we're working on 2023 budget.
Great. Thanks, Brenda. Any questions for Brenda? Okay, so Frank, let's start with you, and then we'll see where we are once you're done. Okay.
Sure. Not a lot this month. I just wanted to share that. Actually, no, there's an agenda item on this later, so I don't have anything to add to my report. Sorry, Christina.
Okay. Well, Frank, do you want to jump to talk about some of the updates that are at the end related to the merger while you're on right now?
Sure. Yeah, I can do that. So probably the big news on the merger is we've got our first list of potential new names for the organization. We got that from our branding consultants yesterday. So those have gone out to the work group that has that's working on this, and we're meeting on Thursday afternoon to kind of take a first look, get some gut reactions, and provide some feedback. So that's exciting, and looking forward to that process continuing to move forward. Still have a few work groups or cross-functional teams that are working on services around children and youth. We also have a group that's continuing to work on us getting to know each other. That group completed a network survey of all of our staff, and so we've got kind of a picture of who's connected to who and who's not, and we've got some work to do on making some additional connections, and we're planning to do some of that work at our all staff meeting. So on June 29th, we will be closing down to the public for that day, just one day, to have an event where we bring all the staff together and do some team building, get to know each other, use what we learned from the network survey to begin to broaden the connection. So excited for that event, and looking forward to having everybody come together for that. The work continues along bylaws and charters. I still owe Christina some follow-up to the board's review, and the Community Services Board has a draft and a memo that they'll be presenting. Their work group will be presenting to their board at their next meeting. So that that work is continuing, and we've been meeting with the county around the financials, Brenda and Jeremy and I, to talk about what that will look like moving forward. It's likely to look very similar, where we're going to have all of the same functional units, but just under the new department in the budget book and through the budget process. So that's starting to come together as well. So lots of stuff happening, and just we keep plugging away at it.
Okay, great. Thanks, Frank. Any questions on that update? Okay, Frank, I'm going to work backwards actually through some of the reports since you were just speaking about the CSB, and I don't think Harmony is here. Is there anything related in addition to what you've already discussed about the CSB last meeting that the board needs to be aware of?
No, I don't think so. I think that, as I said, they're talking about their bylaws. They've had some speakers coming in talking about different issues. I can do some follow-up on that. One of the about 3 months ago, we had a family came in and talked about the tragic loss of their family member due to overdose. And so a couple of things have come out of that that they asked for. Now on our opioid webpage, you can find the monthly statistics on overdose calls in a graphical form. And we'll be updating that every month as Doer puts out their new data for the number of calls. It's not perfect. It's overdoses / poisonings, but it's it can give us an indicator of kind of how things are going. We did also put out a press release on fentanyl, and I want to thank Dr. Claypack and our community partners that helped provide some input into the language for that. And so we did get that word out as well, which was something that we had heard from the families too. So we're still working on a couple of other projects, still working with the legislature on the opioid settlement monies and how those are going to come into the county and be used. But a lot of effort, just trying to address overdoses, and which has obviously been an increased problem through the last couple of years of COVID.
Great, thanks, Frank. Any questions from board members on that? Okay, Liz or Skip, is there anything in addition that you want to add to your environmental health report?
No, let Skip do the update.
Great, thanks.
Yeah, the only update I have is Liz is back with us, so let her say hello.
Hello. Okay, great. Any questions from board members on their report? Okay, the county attorney is not with us today. Children with special health care needs, Deb, anything from you?
Nothing new to add to my report. Thanks.
Yep. Claire.
Hello. I don't have anything new to add to the report. I did want to field any questions related to syphilis to either Dr. K or Rachel Buckwalter, who's here as well. Congenital syphilis was a topic of discussion about 2 months ago. Yeah. And so the state and providers have taken some encouraging steps, and Rachel convened some relevant stakeholders with the Peace of Mind Coalition. Rachel, do you have anything you wanted to add about that?
No, just that we had a good meeting yesterday. The regional office presented the case. The disease investigation specialist who worked with the mother and baby in that situation was able to give us some great details and some missed opportunities. And then we had some good discussion afterwards about next steps. We're planning to put out a press release. Shannon and Dr. K and I are going to work together on that, and we're also hoping to meet with some of the CMC and OBGYN providers in the next week or two, pending a meeting getting set up there.
And thanks, Rachel. Can you just, because not everybody may be aware, and I'm including myself in that, what is the Peace of Mind Coalition?
Yeah, so it was started in 2008. At that point, we got a grant for like a community coalition to address the rise in sexually transmitted infections and to work on educational messaging to the public and providers about the importance of testing and treating and how to prevent STIs. And it's met at certain intervals throughout the years, like every couple of years and then every year. It usually is supposed to meet once a year. We had a little hiatus there due to COVID. So this was the first meeting since 2019, I believe.
Great.
Yeah, and the peace of mind concept came out of we saw an increase in STIs, and the peace of mind was around get tested, so you have that peace of mind to know, whether you're positive or not. So that's the impetus for it. And we did receive money. I don't remember what year it was. It was pre-COVID, and we did do a pretty concerted effort, particularly on the higher education campuses, to get information out in different forms, things like bathroom stall posters. We put out coasters, drink coasters in some of the local bars and restaurants that were willing, that had a QR code back when we didn't know what QR codes were. They were telling us the kids did, so we put them on. Now we have them on all of our stuff, but so it was really designed around trying to address the increase in STIs, which unfortunately, continues and still needs more attention.
Any questions from board? Thank you, Rachel, for taking the time to come and talk about that. That's great.
Thanks, Rachel.
Any questions on that before Claire moves us in a different direction? Okay, thanks. Sorry, go ahead, Claire.
Thank you. No, I said I had no updates, but I realized I did want to just address briefly, in case anyone had questions, the formula shortage that the WIC program has been working through. There were a couple of outreach opportunities supported by the Communications Health Promotion team. Frank Krupa did an interview on one of the local TV stations to clarify messaging, and the team led by Michelle Hall has been responding to increased volume of calls from participants, messages on Facebook, and inquiries from the press. And they've done an incredible job at kind of getting the essential information from people to help direct them to the right location, to talk to their provider if they need to switch formulas, to figure out what's best for them, and then helping them navigate the system to find alternatives. So they've done a really great job at that.
And what's your sense of how dire that situation is in the county compared to other areas of the country?
Frank, do you have any reflections on comparison with other counties? My sense is we're managing this demand for formula, and we're helping our WIC participants find solutions. So it's being managed, but I'll let Frank add any thoughts.
Yeah, it's hard to know comparison wise, but anecdotally, I was in Target last weekend or the weekend before, and there was only a handful of canisters of formula with vastly empty shelves. So we're definitely seeing the issue. As Claire alluded, Michelle Hall, who's our WIC director, has been helping participants. Their team has been helping participants when they contact us with challenges, and I think so far they've been able to find alternatives or formula supplies for all of our participants. It's a little harder to know about the general population, which is why we did put the press release out, because we wanted to encourage folks to talk with their healthcare providers about alternate types of formulas. It does seem like the most challenging piece is for the specialty formulas, that there really aren't other options for those children because of some underlying issue that really gets challenging. I think most others are able to track down enough formula to get by at this point. At least we haven't at least I haven't been made aware that we've had anyone calling saying I have no formula to feed my baby outside of, supporting the WIC participants at this point.
Great, thanks. Shauna? Shauna, we can't hear you. Ed, I'm gonna let you go ahead. Shauna, we can't hear or see you, so go ahead.
No, I was just wondering, you had mentioned that things seem to be okay with people who are enrolled with WIC, but I had heard that on the news that people who have WIC are kind of more limited actually than other people and get where they can get their formula. Is that a problem here in the county or not much of an issue for them?
So the WIC as a program has made adjustments. They've been very flexible actually in trying to, well, I will describe them as that. I'm not sure if Michelle would describe them the same way, but they've been flexible in allowing alternatives and working with the vendors to see what is available and what is appropriate for families. So I think, like I said, in every instance, at least from a WIC participant case, they've been able to work with them and find them either what they need or an appropriate alternative that could be purchased with WIC vouchers.
So Frank and Claire, I'll just read what's in the chat from Shauna. Thank you, Shauna, for that. Who said, I always want moms to have the choice on how to feed their babies. Have you seen an increase in new moms that have chosen to breastfeed versus formula?
Yeah, I don't know that we have data that in this short term that would show any significant change. We already have a pretty high breastfeeding initiation rate in the county. So, we were already there pre this problem with folks starting with breastfeeding, which is good and is probably helping with the situation as well. But I don't think we have any data in the last couple of months that we would be able to say we've seen some kind of change in behaviors because of the shortage.
And I would just add to that, I think the way Michelle has communicated it to me, it seems as if the WIC staff are working with any members who call in with challenges to help them decide what's best for them. So it's, we're really just trying to help find solutions based on what the parent decides is the most appropriate.
Great, thanks, Claire. And thanks, Shauna. Okay, Claire, anything else in addition to that? Thank you for sharing that as well.
I think that's it.
Yeah, great. I'm going to come back to you in just one second, Dr. Claypack. Is there any front thing? I know that from the health promotion program, Shannon, are you stepping in for Sam?
Yes, I'm stepping in for Sam and Ted today. So nothing new in addition to what's in our report, just to say that we, have successfully onboarded a project assistant for the Healthy Neighborhood program, who's really hit the ground running at the beginning of May, and our 2 community health workers are now on board as well. So it's been really busy and exciting here in health promotions.
Great, thank you. Any questions about health promotion?
Shannon's also leading our effort to have an entry in the Ithaca Fest parade. So if any of our board members would like to walk with us in the Ithaca Fest parade, we'd love to have you. Just let us know.
That's right. We have a very creative group actually with Claire and Frank and our health workers and our friends at Mental Health are joining us as well to march together. The theme is Together Again, which really, kind of speaks to our mission right now anyway. So yeah, it'll be fun. I'll put my email in the chat if anyone wants to join us.
Are you doing any handouts or anything? Like, what are you doing? Did you make a float?
Yeah, so this year, the committee behind the festival is really trying to keep Hugo Street clean. So there will be no paper handouts or candy being thrown. If you have items to give away, you can hand them out. So health promotions did purchase some larger items like water bottles and hand sanitizer and Frisbees and things that we can hand out. But WIC and the health promotions will be present to table during the festival on Saturday. So we'll have our paper handouts for then. But we met yesterday to talk about decorating one of the county cars to take with us. And we've got some ideas about how to demonstrate our work together as a safety net for the community. And so got some fun ideas, but if you have any other thoughts, we're all ears when we've got a week to get it together. So
Yeah.
if anyone has any giant cardboard laying around from a refrigerator purchase, Claire would be very interested to receive your giant boxes.
Great. Thanks for doing that. That's a great addition to that parade. So that's wonderful. Okay, so Dr. Claypack, we'll come back to you. Any updates from you in addition to what you have in your report already? And I think you're our last update. So the only thing I would ask is that if Ravinder happens to join us, if we can stop your update and do our votes, that would be great, because I think we're going to lose Shauna here pretty soon as well. So, okay, so with that, which I know is not a great introduction, but thank you, Dr. Claypack, for your flexibility.
Good afternoon, everybody. The media has been talking in the last few days about monkeypox. I think a couple points about it that I understand so far are pertinent. One is that in the United States, it's limited to 25 cases, I believe, that have been identified. In the world, 250. The communicability of it is far, far less than COVID. So you need to start from a point of view of communicability. Where does it fit in the spectrum? And the second thing is that it tends to require quite close contact, bridging an intimate contact. Not that it's transmitted sexually, but that droplet dispersal and the characterization of the dispersal and the communicability requires something more than just passing contact. So I think we're going to be dealing, if we are have to deal with it at all on a local basis, is really target populations that tend to have that kind of close contact. Is this going to become anything major? I don't know, but I think it's far too early to fall into any kind of panic mode or et cetera. I think we'll closely monitor this, of course, and then see where it goes. There are therapies for it, a vaccine and medication, should it ever come to be at that point. So now the other thing I wanted to do was talk just to go back to syphilis and talk just for a moment. So there are two parts to the equation for this issue of syphilis and congenital syphilis. One part is what practitioners do, what they do by good medical practice, and what they need to do by mandates. And then the second part of it is what the public understands. And having the public understand is a big part of the equation. So people's sexual behavior changes dynamically over time. It changes dynamically over the ages, ranging from sexual maturity to old age. And during a pregnancy, it can change within a period of 9 months. If the public is not aware that their sexual behavior can put an unborn child at risk or themselves at risk, that's a major problem. We've gone for a long time where syphilis has not been a major part of our life. And now in the last several years, this uptick is making us realign ourselves with these issues. So our role in terms of public messaging will need to help work towards having us and our partners in the community really convey the reality of syphilis and other STDs, of course. In my practitioner bulletin of a couple months ago, I touched on syphilis and the prior congenital syphilis case that was in another county. The current practitioner bulletin, which will come out later today or tomorrow, will reinforce that with quite a bit more detail. If I could take a moment and share my screen, I'd like to show you one of the graphics coming out in the practitioner's bulletin. If we look at 2021, we had 18 total cases of early syphilis. Early syphilis is the most communicable stage of the disease. For the entire calendar year, 18 cases. For the first 4 months of this year, we are already at 14. That should sound a very strong alarm bell with practitioners and help reinforce them having it in more the front of their mind in their differential diagnosis of disease. If you compare congenital cases in central New York, Oneida County, Onondaga County, Tompkins County, there are 0 cases bumping up in Onondaga and Tompkins. So we're not alone in this, and we're not alone in combating the problem. Just many of you would not have had to think about syphilis, but it has quite a long timeline of going from being exposed to being late. And a lot of your more devastating problems come on with late syphilis. It's in this early phase that we need to stop the spread of it when people are the most contagious. And the problem is that many times what it presents with is not exactly diagnostic. The symptom that somebody comes in with, the signs, their skin rash perhaps, or their symptoms aren't particularly blaring out a message that this is syphilis. It needs to be considered in the differential diagnosis of so many conditions. And the rashes, the chancres can often be quite atypical and therefore make a clinician include syphilis if they are uncertain what's in front of them. And what's concerning for us is that with early syphilis in Tompkins County that we're seeing less cases who are injectable drug users and younger people, we're seeing a spread across a much older age range. And we're seeing problems with the public complying with giving meaningful case investigations, being willing to name contacts, being willing to say where they think they got it from. And the less that the public is cooperating with us, the greater the challenge to trying to really control the spread. The additional factor that plays in here is the extensive use of social media apps, which promote anonymity and make case investigations even more difficult. So we have our work cut out for us. It's not an easy task. It's going to require all of our partners to be on board, passing this message on to all of their populations. It's going to require a lot on our part to put out multiple clear messages, not just one. It's not sufficient for a single message to go out. It needs to be multiple messages on these subjects scattered over time, trying to catch people wherever they might see it and wherever they're more willing to take action based on it. So with that, if there are any questions about my report, I'd be glad to answer any.
Okay, any questions from board members? I think we're good. Thank you for those charts. That actually helps visualize the information a lot better. Okay, well, Frank, we don't have quorum. So unless we know that Ravinder is about to join.
Yeah, we're trying to find out. We haven't heard from him. I've been beating the bushes and I've been unsuccessful in getting anyone else. I've actually never had this happen in 11 years, back-to-back meetings without a quorum. So
Yeah.
I guess I would point to Skip first. Is there any that cannot, Skip and Liz, any that cannot wait another month that we would need to reconvene at another time?
I mean, I think it can wait. We're probably gonna be adding to this list, come June. So.
And
The only, I mean, there's the grassroots resolution on the agenda, but I don't think that, I think we'll be working with them on this. So I think that's really more of the fine issue that we would be pushing forward. They're going to have to get other things together before the next meeting, before the next Board of Health meeting, either way.
And Rachel and Claire, your items, time sensitivity?
I think we can wait, Rachel.
Okay, so I guess it's really up to the will of the board, Christina, on if you want us to try to schedule something between now and next month, or just hold till next month.
Well, I guess my question is, of the board members that are on right now, is there anybody who is not going to be able to be here in June for the June meeting can you look at your calendars right now? Because I think if we know that we've got people starting to take vacations and we lose the ones that we have now, that I think I would ask that we schedule something to make sure that the health department can get done what it needs to get done without continuing to wait for us.
Is that going to be the June 28th?
Right.
Right.
So it looks like Samara's a yes, that she'll be able to be here. Shauna, are you able to check and type? Yeah, I mean, I'm kind of leaning toward where what Shauna's recommending is that we do a special meeting. And Shauna's a yes for the 28th.
I'm a yes for the 28th.
Okay. So maybe if we can talk to some of our other board members, that would be great. And if we know that we can be on the 28th, that would be great. Interestingly, it's not even on my calendar, but I won't put it on the calendar right now, so it's good we're having this conversation. Okay.
All right, well, we'll check with the others. I know Melissa's away with an appointment, so I'd imagine she'll be available as well, which would get us to 5. And we can check in with Ravinder and Dr. Evelyn.
Okay.
And there's
All
somebody.
right.
Okay. All right, well, sorry we weren't able to move those action items. We'll certainly try to make sure we have enough folks for next month.
Okay. So I think with that, then I'm going to go ahead and adjourn unless there's any other things for discussion, items for discussion that don't require voting or quorum. Okay. Thanks, everyone. Frank, can I call you real quick?
You can.
Okay, thanks. Bye, everyone.